My name is Sandra Smith. I'm the Employee Benefits Manager at ACWA JPIA, Association of California Water Agencies Joint Powers Insurance Authority. And that's where your employer gets their health insurance from, along with 260 other public agency water districts throughout California. And we have an exciting benefit that we are launching that's available now, became available January 1st, and that's called Hinge Health. And we have Kathy here to share a little bit about that benefit with you. Before we get started, I will let you know that I had my first appointment this morning with the physical therapist, and I was very impressed with how easy it was to make the appointment, was seen the next day, and the quality of the visit with the physical therapist actually exceeded my in-person physical therapy treatment plan, in my opinion, that I recently have had. So I am super thrilled to be able to have this benefit available to our members. And Kathy, thanks for joining us to share it with everyone.
All right, thanks, Sandra. And hello, everyone, and thank you so much for joining us today. So again, my name is Kathy Nguyen, and I'm a Client Success Manager at Hinge Health. And I'm excited to take the next 45 minutes to share an overview of the Hinge Health programs. And feel free to ask any questions that you have in the chat box, and we'll leave time at the end for a Q&A session where I'll address the questions. So the plan today is to first give you a couple tips about how to relieve stress and pain. And then we'll talk about who Hinge Health is able to help, how our clinical care team can provide care for you, and what you can expect as a participant. And at the end, we'll go over some frequently asked questions, and then we'll open up for a Q&A session. So let's dive in. So I want to acknowledge that you may have joined this webinar today because you're currently in pain, you know someone who is, or perhaps you're just curious about Hinge Health and hoping to find a new, healthier routine. So whatever your reason, Hinge Health promises to fit into your daily schedule with focused, concise exercises, all customized to your routine, your pain, and your body. So to start, I'd like to spend a few minutes walking you through a brief series on some tips to relieve stress and pain. So the first is to observe your stress and breath. So take a moment to recognize your stress and identify it with a name. Then take 5 slow, deep breaths, holding each for 3 to 5 seconds before exhaling. The next is to change your focus. Is there anything about this moment or situation to be grateful for or to laugh about? So we recommend avoiding using terms like at least, and instead think, this is an opportunity for blank. Next is to make a plan to move. Movement really is medicine. So consider a walk, doing some yoga, or whatever gets you moving in order to increase the brain chemicals that make us feel relaxed and positive. And lastly is to dig deeper. If you can't seem to shake it, call a friend or a partner to share your feelings. Even virtually, connecting with someone you trust is a powerful force against stress. So I hope those tips are helpful for those of you facing unprecedented stress. So who we help. I like to start with a couple of brief stories to illustrate some common themes we hear from our program participants. So meet Linnell. She's a 45-year-old county clerk at one of the companies we work with, and she's had chronic knee pain for the last 4 to 5 years. And what we hear from Linnell and a lot of users like her, I can summarize into 3 common themes. So constant knee pain and joint issues were her norm. It was hard for her to even put her socks on. The status quo wasn't working for her. Physical therapy sessions, mounting co-pays, doctor's visits, time off work, and pain medication, they were simply not addressing her pain. And after multiple visits to the doctor, she kept on hearing that she needed surgery. And here's another one. This is Luis. He's a 38-year-old sales executive who started to feel neck pain last year after working from home in a less than ideal environment. He's also recently twisted his ankle on his weekly run around his neighborhood. But the wait time to see a physical therapist is 3 to 4 weeks. Plus, he's too busy at work to take a half day to see a physical therapist. And now meet Jim. He's a 49-year-old engineer who has been considering surgery for the back pain he's been managing for years, but wants to explore all of his treatment options. He knows that there's no reversing a back surgery, and he'd just like a second opinion from a high-quality surgeon. And finally, here's Alex. He's a 36-year-old warehouse employee who was also a candidate for surgery for his knee pain, but was reluctant to schedule it during COVID. And he wanted to manage his pain while he awaited surgery. So as you can see from the stories I just shared, at Hinge Health, we recognize that each individual has unique challenges that they're looking to overcome. And in addition to these individuals, we see folks in the program because, like Louise, they spent the last few years working from home in a less than optimal workstation. We also see individuals who have had a past injury that never quite healed correctly, and they struggle with chronic pain and weakness as a result. So whether you're joining this webinar today because you need care for a recent or a past injury, you're preparing for or recovering from a surgery, you may have a spouse or a colleague who is experiencing nagging pain, or you just want to build healthy habits to live a life with no back and joint pain, Hinge Health has you covered for all of your back and joint needs. And of course, for spouses and dependents on an Anthem PPO or CDHB medical plan through ACWA JPIA, this is offered to them at no cost as well. And it's also important to note that you're not alone. Back, joint, and muscle conditions are really common. So about 1 in 2 people will be affected in any given year. So if it's not you that's suffering from one, chances are you know someone who is. And in addition, with companies switching over to remote working, 71% of individuals are experiencing new or increased pain because of the more sedentary lifestyle that tends to come with working remotely. And while we go through the rest of these slides, I ask that you reflect on the following questions. How is my back and joint pain affecting my mood and quality of sleep? Can I miss half a workday to visit a physical therapist or another care provider? How much will my treatment cost? And this one isn't on the slide, but it's a big one. So how would your life be different without the pain? If back or joint pain is preventing you from doing the things that you love, or even daily tasks like walking up the stairs, then you might find our programs helpful. So here's how Hinge Health comes in. We cover all major muscle groups and joint areas, and we follow evidence-based guidelines, which means we've looked at the literature, the research, and based our whole program approach on proven methods of care. And doing so has allowed us to expand our programs from solely helping users manage their chronic back and joint pain to being able to offer digital programs designed to help you address all of your back or joint needs, including pre and post-op surgery, a recent injury, and prevention to build healthy habits. So going into a bit more about the program design, we built our program around 3 pillars: exercise therapy, education, and expert medical support. Studies show that these are the pillars of successful treatment, and they must be delivered together to see sustainable results. However, your treatment plan will be customized for your needs. So let's start with exercise therapy. By strengthening your muscles around the pain areas, you'll be better equipped to manage the pain and prevent future injuries. So we use technology to make these one-on-one physical therapy sessions significantly more convenient. In-person sessions are often costly and can take a lot of time out of your day. Our exercises are no more than 15 minutes per session, and we recommend 3 exercise therapy sessions per week, so it's easy to fit into your schedule. And depending on your pain areas and program, you may receive 2 or 3 wearable motion sensors that allow you to see yourself doing the exercises in real time and allow your care team to see how you're doing so they can offer helpful tips. Next is education. We equip you with the knowledge that you need to conquer your pain and prevent future injuries through customized educational articles. So each week, you'll get a new article based on your specific condition or your goal and your treatment options, especially non-surgical options. And the last pillar is one of the most important for long-term success. So your customized program may consist of one-on-one interactions with your care team, which could include a physical therapist and a health coach. And in some cases, you may even have an orthopedic specialist offer expert medical opinions on your condition. So here is a preview of what our in-app experience looks like. So each session, you'll receive a series of exercises to complete, demonstrated by one of our Hinge Health physical therapists. And here you see Sonam show a couple of our exercises. So the app will track the reps you complete, providing a countdown time to hold the position, and provide points for each rep as part of the gamification process. So the exercises are customized to each person and can increase in the number of repetitions and difficulty as you progress through the program and begin experiencing less pain. So it's an easy, seamless experience that takes around 10 to 15 minutes to complete each session. And now a bit more about your care team. So as much as we digitize the delivery of care, we recognize that the human touch remains critical within healthcare. All of our health coaches have coaching certifications or backgrounds in healthcare and are extensively trained by our clinical team in the delivery of the program. So their role is to motivate you and to be your accountability partner on your journey throughout the program. And on the right-hand side of the slide here, our clinical team is composed of our chief medical officer and our clinical specialist physical therapist. And they really are the backbone of providing clinical expertise to the team. So their role is to ensure that our program is always up to date with the best practice guidelines and clinical standards. And they're also here for you if you need extra support, such as providing a second opinion on a recommendation you receive from a doctor or help interpreting an MRI. So we've also demonstrated in clinical studies that our programs have a meaningful impact on changing people's lives for the better. So in partnership with top research universities, we've validated that our programs achieve on average a 69% pain reduction, a 58% reduction in depression and anxiety, and helps avoid 2 out of 3 surgeries. And this is why people like Linnell, Louise, Jim, and Alex sought out Hinge Health to help them manage their daily pain and in even some cases avoid surgery. So if you think that our programs can have a positive impact on your life, here's what you can expect throughout your Hinge Health journey. So step 1 is to apply. So you can visit hinge.health/ACWA JPIA-webinar to begin the application process. So you'll be asked to fill out a clinical questionnaire that takes about 10 to 15 minutes to complete. And the questionnaire is similar to what you would normally fill out at your doctor's office. And based on your responses, we'll place you into the program that best fits your needs. And within 24 to 48 hours, you'll receive an email confirming your program eligibility. And step 2 is program acceptance. So you can expect a welcome text or email from your care team. And if you need equipment for your treatment plan, in most cases, you'll receive them in the mail within 2 to 3 business days. And step 3 is to begin the program. So after program acceptance, you can log into the app and begin the Hinge Health program right away. And you'll also be able to set up your initial call with a member of your care team if that's appropriate for you. So included here are our frequently asked questions. So I just want to reiterate that the Hinge Health programs are provided at no cost for employees and dependents 18 years and older enrolled in an Anthem PPO or CDHP medical plan through ACWA JPIA. And you can also sign up and learn more at hinge.health/ACWA JPIA-webinar. And you can feel free to email or call us if you have any questions after the webinar today. Great, so now we have some time for our Q&A session. So again, feel free to use the chat box to ask any questions that you may have. I'll give everyone just a couple of minutes to see if there are any questions. All right. I think we have a couple questions that came in. First is, do you need to have a diagnosis? So no, you don't need to have a diagnosis. So you can just answer the questions on the clinical screener, and then our clinical care team will review your answers and route you to the most appropriate program for you. Another question we had is, if we need to order supplies, is there a cost for that? So no, everything is no cost to you. We will ship the supplies, and you can actually keep the supplies, so you don't need to worry about shipping it back once you complete the program. I'll just give everyone a few more minutes to see if there are any other lingering questions. So another question we had is, what is done with the equipment once the sessions are completed? So you can feel free to keep the equipment. So once you're done with the sessions will still be available in the app if you want to go back and continue doing those sessions, even if the core program is completed. So you can feel free to keep the equipment. If you would like to return the equipment, you can reach out to our care team, and they can facilitate that process. So another question we had is, does this program reduce the amount of PT visits allowed by our plan? So Hinge Health is a separate benefit from your medical plan. So I do not believe this reduces the amount of PT visits allowed by your plan.
That's correct. It wouldn't be tracked in the same system at all.
I have another question here. What hours are coaches available? I believe coaches are available between 7 a.m. and 7 p.m. So our coaches are located all across the US. So they're available at Eastern, Pacific, Central Time. So whatever works for you. Great. I'll just give everyone just another minute or so here to see if there are any other questions.
Also, if anyone is on a phone or having trouble with the chat, you can feel free to unmute at this time and ask your question verbally if that works better for you. I'll just reiterate what I did at the beginning, which is that my questionnaire indicated that it was appropriate for me to see a physical therapist. I've been having plantar fasciitis issues, and I just was so impressed with the physical therapist that I saw. Not just that it was more convenient, but she explained things to me better than I've had explained so far. And I think that the exercises might make a difference for me. So very excited. There's another question in there, Kathy.
Yes. The question here is, do you keep the same coach throughout treatment? So yes, you do keep the same coach throughout treatment. If for some reason you prefer a different coach, you can reach out to the support team and they can facilitate that process as well. We do have coaches who are Spanish speaking. So once you go through the clinical questionnaire, you can reach out to the support team and request a Spanish speaking coach. But I do want to caveat that our app and the articles and exercises and everything like that will be in English.
This webinar was recorded, by the way, so if you want to share it with a spouse or a coworker, you can go ahead and do that. I'll send out a link to the recording after we're done. Another question there.
Is there a limit for the number of sessions? So for exercise therapy sessions, there are no limits, but for physical therapy video calls with our physical therapists, there is a limit of 12 video calls per year, per calendar year.
Every time I think we're done with questions, one pops up.
Yeah. Just give everyone one more minute to see if there are any last questions. And again, if you have any questions after the webinar today, you can feel free to reach out to us via email or our phone number. And you can also learn more about our program and sign up for the program at hinge.health/ACWA JPIA-webinar. And that will have a lot more information and it will route you to that clinical screener. So if there aren't any other questions, thank you everyone for attending the webinar today. And I hope you all have a great rest of your day.
Thank you, everybody.
Thanks, everyone.